Hello everyone, my name is Corey Meeks. I am a student at Franklin University. Today we're going to be talking about special populations in primary care regarding to mental health and how mental health affects different populations, and how as clinicians we must adapt our care or understand different ways in order to screen the patients and deliver the best health care possible by providing medications through thorough assessment. When focusing on mental health care for the elderly population, when it comes to mental health diagnoses, we need to consider all traditional psychological diagnoses such as anxiety, bipolar, OCD, schizophrenia, and many others. However, it's very imperative the patient must be screened for depression, which is common among older adults. Older adults often face health challenges and life challenges that may put them at higher risk for depression. Of all mental health disorders, the elderly population makes up 15% of that number. So in actuality, that's a low-cost population when talking about mental health. However, the economic burden can be a financial strain on the patient. That economic burden not only falls on medical institutions, but also on the patient when dealing with mental health disorders. Oftentimes, special grants or programs may be available to help the elderly patient get that care that they need. Now, financial burdens that the patient will have may cause the patient to not seek medical attention or get the proper diagnosis, which would entail referral to outpatient services for counseling. The patient may not be able to afford that or have the access to care through transportation. So all these need to be considered with these diagnoses. The clinician also needs to consider the patient's age. As the patient gets older, they may develop dementia, affecting the ability to accurately diagnose. Now we're going to discuss assessment and screening tools when focusing on the elderly population. Now, for mental health disorders, it is important for under an assessment related topic, it's important to gather lab work such as a CBC, BMP, TSH, and HbA1c. The reason for this is to rule out that the patient's mental health symptoms are being caused by a medical issue, such as a hormone imbalance, an electrolyte imbalance, or something along those lines. Now, the HbA1c is important to get as it will rule out the patient is suffering from any hypoglycemia in the past 3 months, which could be causing, if the patient is having low sugar, could be causing confusion and leading one to believe that the patient is actually having a mental health disorder. Other assessment considerations include gathering social information on the patient and a more in-depth history. Other medical conditions that can cause confusion and mask mental health disorders is insomnia. Oftentimes the elderly population has difficulty sleeping, staying asleep, is not getting the adequate rest they need. Now, from a social standpoint, the patient needs to be ruled out for any type of substance abuse, concerns of abuse in the home. Does the patient have financial stability? Are they unable to pay for their bills at home? Do they have electric to the home? Do they have water to the home? All these things can lead to depression and other mental health disorders. Does the patient have access to health care? And whether or not the patient can care for themselves in the home and complete activities of daily living. And all these can be done during the assessment of the patient. Just lay eyes on your patient. Does the patient look disheveled? Does it look like they're well kept? Do they have dirty, long fingernails? All these are signs that there may be trouble in the home, and the patient may not be able to take care of themselves. One, because they don't have the strength or ability, or two, they are suffering from a mental health disorder and are just not able to focus on those activities of daily living anymore. When considering pharmacologic interventions, such as for the treatment of depression, in the geriatric population, first-line agents would include selective serotonin reuptake inhibitors, or SSRIs, also serotonin norepinephrine reuptake inhibitors, known as SNRIs, and norepinephrine dopamine reuptake inhibitors, which are NDRIs, are all recommended for older adults. Some examples of these would be bupropion, duloxetine, sertraline, and other options such as mirtazapine, especially with patients with insomnia or poor appetite. In the elderly population, the thing to avoid when considering pharmacologic interventions is not to prescribe any tricyclic antidepressants. When considering collaborative interventions, the clinician must be mindful that this includes not only themselves, but includes a behavioral health specialist and a psychiatric consultant, all working together in a multidisciplinary role to provide the patient with a better health outcome. Considering psychotherapy, studies have shown that positive psychiatric interventions, which target social connectedness, meaning of life, wisdom, and resilience, can improve the overall well-being and other positive health outcomes amongst older adults. We will now discuss perinatal and lactation as a special population. When considering a mental health diagnosis for a perinatal patient, the clinician must consider the diagnosis of depression or anxiety. Oftentimes, a patient can go through a perinatal depression due to hormone imbalances and stress. This stress and depression can also cause difficulties with lactation, which can increase the anxiety of the patient. So during the pregnancy, the patient needs to be followed closely for mental health disorders. The economic cost for perinatal health disorders was roughly $16.5 billion in a calendar year, and that's without even adding in the cost of maternal suicides. Assessment for the perinatal patient should include routine lab work, including a urine analysis to rule out any medical diagnosis that may be mirroring a mental health disorder. It's also important to interview the patient regularly as you see them and gather any social changes or risk for depression. Screenings for the perinatal patient, we need to screen for conditions like depression and anxiety using tools like the Edinburgh Postnatal Depression Scale, or EPDS, and the PHQ-9 G87, beginning at the first prenatal visit and continuing through postpartum care, ideally with at least one visit in the second trimester, third trimester, and at 6 weeks postpartum. The assessment should also include a psychosocial evaluation of the family history, social support, and substance use, as well as the screening for bipolar disorder and thoughts of self-harm or harm of the baby. When considering pharmacologic interventions for the perinatal patient, the main focus is to ensure that you are prescribing a medication that is both safe for pregnancy and for breastfeeding. The clinician must ensure that the medication is safe and is not going to cause any further complications or harm to the mother or the child. Collaboration interventions for this patient include not only psychiatric and primary care, but can also include the patient's OBGYN as a multidisciplinary team to treat the patient's conditions. Psychotherapy interventions can be a multitude of things, including group therapy with other patients going through the same types of issues. Also, the patient just may need someone to talk to more on a regular basis, such as an outpatient counseling. That could also be considered. There are also special programs available like art therapy, where the patient can just have time to relax and distress and focus on themselves. Mental health is a high risk in the adolescent population. A recent study by the CDC showed that 39.7% of students experience persistent feelings of sadness and hopelessness. 28.5% experienced poor mental health. 20.4% seriously considered attempting suicide, and 9.5% had attempted suicide. When assessing adolescents, age is a determinant, as well as the maturity level and the patient's sex, whether they're male or female. The clinician needs to guide their patient history taking and explanations of procedures and diagnoses based on where the patient is cognitively. In some cases, patients will, depending on sex, females and males may have different health diagnosis or different risk factors for developing a mental health diagnosis. When assessing for mental health disorders in adolescents, this will be done through clinical observations, history taking, and psychological screening to test for disorders such as depression and anxiety. It is also important to gather social information on the patient, whether they are abusing drugs, alcohol, or tobacco, whether they feel safe where they live, and whether they are having an issue with bullying at home. And also you need to assess their diet for any type of eating disorders. Screening tools for adolescent mental health include broad measures like the pediatric symptom checklist and strengths and difficulty questionnaires. Specific tools such as the patient health questionnaire for depression, generalized anxiety disorder, the GAD-7 for anxiety, and the Ask Suicide Screening Questions, ASQ, for suicide risk. Common pediatric or adolescent medications used to treat mental health conditions are selective serotonin reuptake inhibitors, or SSRIs, which helps with the patient's diagnosis of anxiety, and also specialized medications for ADHD or ADD, such as Ritalin or Concerta. Collaborative interventions include the primary care physician, the psychiatrist, and the parents. The clinician also needs to include the guidance counselor at the school if there are issues with the school or if that patient confides in that guidance counselor. With all these different collaborations working together as one, they will give the patient the best possible health outcome. Psychotherapy can be beneficial to an adolescent, such as group counseling, individual counseling, where the patient can have a trusted adult that they can confide in to share information so that they are not holding it in. Although a health professional is recommended, the patient may seek guidance from the school's guidance counselor, and if that counselor determines that there is a need for outside services, they would be able to reach out to the parents or the clinician. Members of the LGBTQ community face increased risk for mental health conditions like depression and anxiety due to minority stress caused by discrimination, stigma, and lack of acceptance. Suicide rates and suicidal ideation are significantly higher among the LGBTQ community compared to individuals in the general population. With this special population, also need to consider age, as younger members may not be open in public and may have reserved stress and anxiety or thoughts of harming themselves due to the fact that they lack the confidence of social acceptance. When discussing economics associated with the LGBTQ community, due to discrimination and stress, will oftentimes lead to economic disadvantages, which worsen mental health outcomes. Assessment of this population would be the same as that of any other populations, which include laboratory testing and a focus history and interview. Considerations for this population during the interview process are to ask more questions regarding their identity and whether they are suffering from any anxiety or depression from outside sources, being pressured such as discrimination or bullying. When performing interviews or assessments with the patient population, it is important for the clinician to be empathetic and address the patient as how they want to be addressed. The main focus is to diagnose the patient's mental health and make sure that they are receiving the proper treatment. Screenings for mental health conditions for this population will be the same as any other, with that being an anxiety screening using the PHQ-9, depression screening using the GAD-7, and also a suicide risk screening, as patients in this special population are at higher risk for suicide. Considering pharmacological interventions for this special population, the standard psychological medications would be used, as this population has no special considerations. The clinician just needs to be mindful of what other medications the patient is taking and make sure that there are no drug-to-drug interactions before prescribing a medication to treat the patient's mental health disorder. Collaborative interventions for these patients would include an interpersonal collaboration between the primary care physician and psychiatrist and any other outside sources that are assisting with the patient's mental health care. Psychotherapy for this population of patients can include counseling services, whether that be a one-on-one or group therapy. Also, the patient may find help with surrounding themselves with special population groups that will offer peer-to-peer support, these patients that also are in the LGBTQ community. When considering mental health diagnosis for immigrant and migrant workers, the clinician needs to be mindful that the risk for anxiety and depression in this population is especially high. This population may suffer from increased stressors such as job loss, separation from family, discrimination, being around others in a community that is not of their ethnicity, and also just lack of family ties and social support. Due to the increased mental health disorders in this population and the lack of financial resources puts a burden on the healthcare system. Assessment and screening tools for this population would be the same as those for others, such as laboratory labs to make sure there's not a medical condition going on that is masking or mirroring a mental health disorder. Although the clinician does need to give special consideration to this population when it comes to communication and history taking. The patient may not be fluent in English, and a translation may be required to assist that patient. It is the responsibility of the clinician to make sure the patient has a medically certified translator and that the patient is receiving all the proper information. Without clear communication, a mental health disorder could be missed, which could be detrimental to the patient's health. The patient also needs to develop a relationship where they feel like they have a safe place with the clinician, as these populations can oftentimes not divulge all the information. All pharmacological interventions can be considered with this special population, as with many others. Once again, the clinician just needs to be mindful of what medications the patients are already taking and check that there are no drug-to-drug interactions. With this population, it is also important to ask during the interview process if they've ever been on a mental health medication before. The patient may have been on a medication where they lived previously overseas or in a different country and no longer have that medication or the access to get it. This may be a simple solution to a patient's mental health disorder, as maybe they just need to get back on their medication that helped them in the past. Collaborative interventions for this patient care would include the primary care provider and psychiatric services, as well as any other social services that the patient may have that they interact with that could affect the patient's overall mental health outcome. Psychotherapy may be a little more difficult with this special population as they are the minority in some areas, and finding a peer-to-peer group can be difficult. It is impossible if referring the patient to outpatient counseling that the clinician get the appropriate counselor who is able to communicate clearly with the patient and speak their language, which will help them have more trust in the counselor and improve their overall mental health outcome.